Do we have anyone on the line at this point?
Hi, this is Dawn James in Kit Carson County.
Hey, Dawn.
Hello.
This is Mary O'Gara from Aspen, Colorado.
Hi, Mary.
Hi, this is Samantha Decker with Tri-County Health Department.
Hello, Samantha.
Hi.
All right. I have a few more registered, but for the sake of time, we're going to go ahead and get started. Hard to believe that we're already on session 8, going through the DSME Business Plan Guide, and this session is focused on financial plan and projections for your DSME program. So thank you for spending a few minutes with us this afternoon. This is Meredith with Intelligence, and I come to this work through our contract with the Centers for Medicare and Medicaid Services, specifically focused on increasing utilization and access to diabetes self-management education in Colorado.
Hi, everyone. This is Ingrid Crew here at the Colorado Department of Public Health and Environment. And I participate on these calls as a co-host with Meredith from a CDC grant to increase and promote DSME in Colorado. And so the purpose of this call is, due to the prevalence of diabetes education amongst Coloradans affected by diabetes, we really value these sharing calls as an opportunity to partner with you to discuss barriers to DSME utilization, share success stories, and then identify tools that might be helpful in increasing utilization throughout the state. So welcome.
And I know the three of you have been with us pretty consistently in the past, so I'm not going to spend a lot of time on this slide particularly, but just wanted to mention over in the chat, you'll see the link to the DSME Business Plan Guide. Inka also provides that link in her follow-up notes, but just want to ensure that you all have easy access to that as we're discussing the guide as we go along.
Just, Meredith, you need to advance the slides, but you don't have the ball either, so.
Sorry about that.
It's okay.
Emily, this is Meredith. Can you go ahead and pass the ball over to me, please? Emily, are you with us? Well, while we're waiting for that, I'll go ahead and go through the housekeeping items, and we'll get you caught up to the slide we're on once we get that ball over. Just remember, if you could, to place yourself on mute when you're not talking, which you can do by pressing *6. That will mute and also unmute you if you'd like to add something. Please don't place your line on hold to avoid hold music for those of us still on the call. When you have something to contribute, please state your name. We like to promote depth in sharing, step up and step back. Chat, we do have open, so feel free to chat in questions or comments, and we'll certainly address what we have time for or follow up with you throughout the meeting. And the meeting recordings and notes, as always, are made available by Inka through the CDPAT website, and that link will be sent to us after the meeting. All right. I'm still not seeing that the ball has been passed to me. Emily, this is Meredith. Can you please make me the presenter? All right. Inka, are you seeing our state slide now?
Yep, we're on the state slide.
Perfect. Thank you so much. So all of those of you that are on the WebEx with us, as we usually like to do, if you could left-click your pen up in the left-hand corner, and then left-click your arrow and drag your arrow to wherever you're located in the state. Plop yourself on the map. See you, Samantha. Okay, and do we have anyone on the line that's not on WebEx?
I'm on WebEx, but I can't drag my arrow. This is Dawn.
Uh-oh. Anyone else on the phone that isn't joining by WebEx that hasn't introduced themselves yet this afternoon?
Yes, this is Betsy Robbie from the West Division.
Hi, Betsy. Thanks for joining. Anyone else we missed?
Yes, this is Jim Munson in Victor.
Hi, Jim. And which organization are you calling in from today?
I'm private. It's the first time I've attended these, and I am seeking information.
Okay, great. Well, welcome.
Thank you.
You'll see in the chat, are you online with us today, Jim?
Yes.
On WebEx?
Yes.
Oh, okay. So you'll see in chat there is a link to the DSME Business Plan Guide, and that's what we use to guide these conversations. If you want to open that up, you'll see that we're in Section 8 talking about the financial plan, and that will allow you to follow along a little bit closer, and then after the call, Inka or I would be glad to speak with you and kind of catch you up with where we've been prior to today.
So the call for today are learning objectives. We've been trying, for the last 2 months, I've been incorporating the new DSMES 2017 National Standards. And so we'll talk about one of those standards today. And then identify 4 types of key productivity ratios. And so I will just quickly cover the examples in the business plan guide. And then our facilitated conversation will be on those productivity ratios and educated DSME billable hours, scheduled versus non-billable time, and would love to get input from you all on how you track your time running a DSMES program.
All right, so as always, we like to hear from our audience, and our polling question today is, my level of personal involvement with the financial aspects of our organization's DSME program is, first option, highly involved. This would be things like financial planning, projections, budgeting, evaluations, program income, revenue, expenses, time studies, claim denials, resolution. Second option is moderately involved in a few of the above-mentioned areas on a pretty consistent basis. Next, minimally involved, rarely consulted or informed of program's financial status. And the last option is not involved at all. So our poll will pop up over to the right of your screen if you're on the WebEx. If you wouldn't mind choosing the option that is appropriate to you, and be sure to hit your submit button at the bottom. Have about 20 seconds to do that. All right, so we'll just wait for the results to come in here in a few seconds. This morning we saw that moderately and minimally involved were the most popular answers in the same session we do in the 8:30 meeting. This is where we need our Jeopardy music, and we're waiting for the results to come up. All right. Okay, so we definitely have this afternoon more of you that feel like you're highly involved in financial planning, which is excellent. One response for moderately involved and one for not involved at all. And again, myself, of course, didn't provide an answer for that. So thank you for that information. That helps us set the stage for our facilitated discussion.
So we've been incorporating the 2017 National Standards for Diabetes Self-Management Education and Support. As of May 1st, all of our accredited and recognized programs will have to follow the 2017 standards according to ABA and AADE, and so we'd just like to continually highlight that in our conversation. And so here is the link for that PDF. If you don't have it or need a reminder. Next slide. So today I am highlighting Standard 5. Since we're talking about an educator's time, I just wanted to highlight one of the requirements for the 2017 standards is that at least one of your team members you have to have at least one team member responsible for facilitating DSMES services and the credential required. And so here's the standard, so I just wanted to highlight that out. I went back and forth between this one and Standard 10, which was clinical quality improvement, but we highlighted Standard 10 in the last two calls. But Standard 10 also kind of aligns with our topic today because you could easily make this a clinical quality improvement project trying to maximize a diabetes educator's time as well. So yeah, we'll continually just bring up the due standard for the next several months. And then also I'm seeking feedback from you all if you want us to do more on the standards. And so we're happy to incorporate more training opportunities on the 2017 standards. But I also do know that ABA and AADE provide a lot of technical assistance as well. So whatever you all need, just let us know.
And feel free to use the chat function if you want to chat in how you're feeling about the new standards, if you would like us to spend some time on that or if you're pretty well comfortable with that. So before we get into our facilitated discussion, I kind of just wanted to do a quick summary of this section, which starts on page 22 in the business guide. And I really liked the setup of this section because it started on page 22 just getting you thinking about all the different program revenue sources. And so I just highlighted that here in the first bullet, but the main one being insurance reimbursement. Really trying to maximize Medicare, Medicaid, and private insurance. Those are your main revenue sources. But then also, that's not going to be 100%. That won't cover 100% of your program. And so thinking about other funding sources like grants and private donations, patient out-of-pocket payments, various cash flow strategies, and then coming up with metrics, financial outcome measures and metrics to figure out if your program is making a profit, breaking even, being sustainable. And so the next set of slides, I'm just going to highlight the 4 examples that they go over for productivity ratios. And so when I spent some time thinking about how to facilitate this conversation, I just put myself in the shoes of if I were running a program and never tracked any of my time ever and wanting to do this. And so I just found that these tables, which are in the back of the business plan guide, very useful just to kind of start thinking of my time. You know, if I work 40 hours in a week,
how much of my time is actually getting paid, and how much of it is going towards running the program. And so the first one is ratio of an educator's billable hours versus billable hours completed. And so your target in an ideal world would be 100%, that every client that you see is billable. The next one is ratio of an educator's DSME billable hours completed versus work hours scheduled to capacity. So here's an example where we work 40 hours, but not all 40 hours of our time is billable. And so how much of it is billable? So this gives you a percent. And so if you're billing, this example they have here is if you're billing 17 and a half hours and you work 32 and a half hours a week, 54% of your time is billable. Next slide.
And you can see above each of these types of ratios if there's a target reference. And that target comes from Marianne Todorowicz, is the national expert on DSME services, programs, and billing utilization. So that's where these targets are coming from.
So the next one is scheduled time of DSME versus percent of time scheduled for other tasks like financial, operational, marketing, CQI. And then the last table is ratio of non-billable time before and after a class, such as teaching prep, charting, scheduling. So again, just really simple charts to walk you through how to assess your time. And then the last chart looks a little bit overwhelming, but when you really quickly look at it, it's really the four charts combined into one. And so just looking at your 8-hour day and then plus your weekly totals. So again, we just, if you're one that you're not charting your time at all, or maybe trying to chart your time, or maybe you are charting your time extremely well, kind of aligning and seeing if this is something that's similar or vastly different. And if it's vastly different, we'd love to hear kind of what you're doing to share with the group, because this is what the calls are really about, is to share information with each other of best practice. And so going into our facilitated conversation, my first question is, please share with us, do you have a current mechanism in place that allows you to monitor your productivity ratios? Are these examples familiar to you, or are they really unfamiliar? So I'm going to stop talking and open it up to you all.
This is Dawn in Kit Carson County. So I've never done this kind of a ratio. The time that I spend in prepping and charting afterwards are not contributable to my actual face-to-face time with my patients. So I've never really thought about, it's just a part of my job. So it's interesting to me. I've never done a productivity ratio because the time I do DSME, that's all I'm billing for is that time with that client sitting in that chair.
Thank you for sharing, Dawn. And so does this make you consider thinking about your non-billable time and tracking that and how much it's costing?
Well, we're in a unique situation. In my agency, we have a budget for nursing time, and so it's just billed out to that, and in my budget. So it's not really something that I've needed, but I could see why, if we're a standalone clinic, or some other situation, but we're in a unique situation. The county pays for all that non-billable stuff. So.
Great. Anyone else would like to kind of?
This is Mary O'Gara from Aspen. I've done this numerous times. It seems like every few years our hospital gets uptight about this issue and ask me to do it. So it's, you know, it's an interesting exercise. It's very time consuming, I think it is, when you're trying to first track all this stuff. But I haven't found it to be too useful when I've done it and not done it. So, you know, my programs never run financially in the positive, so it is a subsidized program from our hospital, whether I'm busy or not busy.
Is there an aspect of one of these ratios that caught your eye that you found that would be useful, or?
I guess the only thing, this is Dawn again, I think the only thing that I would be interested in tracking this for is to see what the actual cost per patient is. So that we can do projections for FTE in the future, because I'm not sure it's always going to be the way it is with me running the show. I'm the director here. I have control over my budget. I have control over the FTE. So when I'm gone, that may not be that won't be the case. So it would be helpful to at least demonstrate the cost of it. And I'm like the gal from Aspen. It's a service. It's never going to break even. It's a service community. So that's where we come from. So.
This is Betsy.
Sarah, how do you track your time?
Can you hear me?
Hello?
Yeah, can you hear me?
Can you hear me?
Maybe I have to pick up the phone. This is Betsy with New West, and you know, similar. I think it was it Joanne that our company has requested that we, you know, just kind of keep track of where we're spending our time. So we have a spreadsheet that we complete weekly. Each of the educators complete weekly, you know, with our you know, what we've done. So, you know, whether it be a call like this or, you know, face-to-face time with patients, you know, classes, that type of thing, so we keep track of it. And I know what I do every day, so it's not helpful to me, you know, whether or not it's helpful to them. Haven't gotten much feedback there.
Okay. Does your tracking form look similar to this, or?
Yeah, I would say so. Yeah, I mean, we word it a little bit differently, but yeah, I guess it would be similar.
Okay. Just wondering if there was something that was very different and you thought to be very useful to share with the group.
I mean, we make all of our own handouts and you know, a lot of our materials. So I think that's a pretty time-consuming thing. It's, you know, we're proud of what we do. We like to have our, you know, our name branded on it. So we're not paying for a, you know, sort of, you know, canned education like template or you know, handouts or whatever. So that's a lot of work, and you know, I think that's maybe just the one thing that I don't see on this chart here.
Great, thank you.
Okay.
This is the Cherry County Health Department. I think one of the things that kind of jumped out at me was the kind of estimating the 15 minutes prepping before and then 15 minutes afterwards. And that's probably maybe, you know, obviously an average, but I think probably depending on the population that you're serving, it could be a lot more time than that spent on prepping and or probably even afterwards, especially if you're assisting any of the clients finding resources in their community, whatever their need might be, or even just looking into a new medication that's come on the market, you know, that maybe you're not as familiar with. That 15 minutes goes pretty quick if that's what they're looking kind of as an average.
Absolutely. And I, you know, from gathering, looking at this, I think it's very modifiable to kind of of each program specifically. And I think that's what we're just trying to highlight is that most of our time spent on DSME programming isn't billable. And so if you're trying to sustain your program, how to justify that non-billable time is of value because it's the outcome. And so if you have a patient that requires a little bit extra support and resources, like looking for outside resources to help them manage their diabetes, ultimately that leads into their management of their diabetes, right? Like theoretically, we hope that everything that we do for our clients. So yeah, you're absolutely right, Samantha. So thank you for highlighting that aspect of it. That 15 minutes before and after it gets eaten up real quick. So
another piece of that that's not captured in your example of what those non-billables is I'm actually working with the providers that referred. So a lot of times this is Dawn again, I'll have to follow up with the referral primary care provider to go through care planning and recommendations for moving forward with the patient. So that can be pretty time-consuming as well.
Well, this is great feedback. Like I said, these are just examples, and I just really wanted to pick all of your brains since you are on the ground day in and day out, thinking through what we can develop from Meredith and I to support if it's something of having some sort of tracking log would benefit you all. So.
And I see that Mary shared through the chat. I think I have saved 2 admissions of DKA in the last few months. And also the money that comes into the hospital for the labs, I get the patients to do following the ADA standards. Thank you, Mary, for that input. Yeah, and those are exactly some of the things that don't always surface when you're looking at these types of financial evaluations that are so important for your executives and your leadership to understand. That's actually a great segue into our next call because you'll see at the bottom of this slide that the next section of the DSME business plan guide is focused on the clinical plan. So our next calls are on March 21st, same times available, 8:30 and noon. As far as what we would like you to do, we had a question this morning on if this citation on the slide is the most recent standard of Medicare or medical care in diabetes. So Inka and I will confirm that. I know when I was looking at those standards not long ago it was, but we'll definitely confirm that that's right. So if you could, before the next call, look at the ADA standards of medical care and find one clinical recommendation that you feel like your organization, health system, referring clinicians might not be aware of, and be prepared to share that back with the group in March. So as always, our time goes by very quickly, but we thank you for spending your time with us this afternoon. We'll always leave reference to these data sources for diabetes impact in Colorado in case you ever need to work that into your reporting or your business plan. And in closing, you can reach Inka or myself at any time using the email addresses or phone numbers on this slide. And if you wouldn't mind taking the survey, that'll pop up when you close the meeting. So Inka and I can always keep our eyes on providing what's most valuable to you. And just a plug, hopefully you all have received the save the date for the April 20th in-person event. for DSME and DPP program support. We're bringing Marianne Todorowicz, the national expert, here to Colorado. So excited about that event and hope you all might be able to join us for that. Any questions or thoughts before we close out for the day?
Just wanted to clarify, I think the survey comes up on the right-hand side where you do the poll results. You'll see the survey pop up. So before you close out.
Thanks, Inka. All right, great. Well, we hope you all have a great week, and we hope to talk to you all next month. Or in the meantime, if you have any questions or concerns.
Thank you, everyone.
Thank you.